So guys, today we are going to see spinal cord. Okay, in the spinal cord, what we have to see, first of all, the structure of the spinal cord. After that, white matter, gray matter, and tracks. Okay, that is the part of the physiology. Okay, we just see. Okay, and after that, we have to see the blood supply of the spinal cord. In this portion, we have to understand one very important concept, that is the upper motor neuron palsy or the lower motor neuron palsy. Okay, what will happen if there is upper neuron palsy in the right side? So which part of the face will be affected? Or in the lower motor neuron, if there is palsy like left lower motor neuron palsy, okay, so which part of face it will be affected. Okay, and what is the Bell's palsy? Okay, that we will see. So first of all, the spinal cord, right? Spinal cord, can you tell me the extension of the spinal cord, from where to where it's extend? Can you tell me the extension? So spinal cord extensions up to the from C1 to L1, C1 to L1 in the adults. In adults, right? Whereas in the newborn, it's from C1 to L3, newborns, right? So in the newborn up to the L3 level, so this will take 2 years. In the newborn, it is from C1 to L3, it will take 2 years to convert into this. In the adults, what will happen here? It will change from C3 to L1, and it will take around 2 years, right? So this is the thing, sir. First of all, you have to understand what is the extension of this spinal cord. Now I am going to draw here one diagram of the spinal cord. Okay, so before that, can you tell me the lumbar puncture? We are doing for CSF, taking CSF out from this spinal cord. Okay, so we have to do lumbar puncture, right? So from which vertebra, in between which vertebra we have to do that? That is between L3 to L4. Okay, very important question, between L3 to L4. So here I am going to draw one diagram for the this spinal cord. Okay, so see here. In the here it's from C1 now. So which border? Upper border or the lower border? Tell. Obviously it's lower border. From here it's the lower border. And this in the adults, L3, upper border or the lower border? It's the upper border. Upper border, okay. Nowadays what happening in the entrance exam, in the PG entrance exam, they are asking like this. Lower border of the C1, upper border of the C1, like this. Okay, so you remember the border from lower border of the C1, and here is the ending up to upper border of the L3. Okay, here I am going to draw one spinal cord diagram. So this is the spinal cord. You know, in the cranial there is a meningeal layer, right? So 3, that is the DAP. DAP, you know, D means dura mater, A means arachnoid member, and P means pia mater, right? So same is here. There is also 3 layers, here is also 3 layers. Okay, what is the difference? That is the cranial dura. Cranial dura has 2 layers. 2 layers. Okay, whereas the spinal dura, it has 1 layer. In the last video in the CSF, I told these things, okay, but still you have to remember these things. So this is the spinal cord. Okay, now meninges. So I am going to draw this meninges. So this is, you know, from outwards, from outer to inner. So which will be here near to this? That is the pia mater. So here is the pia mater. This thing is the pia mater. This thing is the pia, right? Yes. After that, there is the arachnoid membrane. So, I am drawing arachnoid membrane. This is the arachnoid membrane. This is the arachnoid membrane, right? Yes. Here is the arachnoid membrane. And this is the pia. And now there is dura mater, right? So cranial dura, it has two layers, but here in the spinal cord it has only one layer. So we have to draw only one layer. This is. So this. So if you want to give name, then this is what? Dura. Dura mater. Here is what? Arachnoid. Arachnoid membrane. And what is this? This is the pia. Pia mater. So inside the here is the arachnoid membrane. Inside the arachnoid membrane, what is this? This space is called subarachnoid. Arachnoid membrane is here, and it is inside the arachnoid, right? So subarachnoid space. This is the subarachnoid space. And here, what is here? What this thing? Can you tell me? This is the CSF. Yes. In CSF, what we have to read? We have read that there is from fourth ventricle, the CSF is entered into the central part of the spinal cord. See here, it's entered into the spinal cord. Okay, where in the subarachnoid? Here is the subarachnoid. This is the subarachnoid space, and one thing is the there in the brain, central nervous system, there is one subarachnoid space. Okay, so from fourth ventricle, it's entered into the spinal cord and the subarachnoid space of the brain, right? So here is the subarachnoid space, and its content CSF. CSF is here. This is the very important things. Now in entrance exam, what is this? This term is the phylum terminalis. So this thing is the phylum terminale. This. What is the phylum terminalis? If there is questions, okay, like MCQ, what is the phylum terminalis? It is nothing. It is the modification of the pia mater. See, here is the pia mater, am I right? And pia mater is modifying and giving one structure that is called phylum terminalis. Phylum terminalis. Okay. Can you tell me the modification of the pia mater? Which structure it will give? One thing is the phylum terminal. Second thing is there is one septum. There is one septum. Okay, subarachnoid septum is there. That is also. Can you tell me some other things? Denticulate, like that. There is one thing. Okay, that is also from this pia mater. Okay. Once I finish all this, I will write modification of the pia mater. Okay. So there is one MCQ. Okay, which one of the following is the modification of the pia mater, or which one of I mean all of the following are the modification of the pia mater, except like that they will ask. Okay, so phylum terminalis, this is the thing. Okay, now lumbar puncture we have to do the this level L3 to L4. Okay, now one thing is spinal dura. This is the spinal dura. This outermost spinal dura converts at the level of S2. Yes, it converts at the level of S2 and continue up to the coccyx part. Coccyx part, right? Coccygeal part is there, so up to coccygeal part it's converting, right? Now one thing I want to tell you, spinal cord is like this, but in two regions, in two places, it's getting enlarged. So enlargement of the spinal cord, from where it's getting enlarged. Enlargement, right? One in the cervical part, and one in the lumbar part. 2 times spinal cord getting enlarged, right? In the cranial cervical part, from C2 or C3, tell me, from C3 to T1, right? From C3 to T1. Why this cranial now, why this spinal cord getting enlarged? Why? Because in the cervical region, we know here is what? Brachial plexus. To give brachial plexus, it's getting enlarged. And in the lumbar regions, it's giving lumbar plexus, right? So this cranial now coming from here, right? So what happens actually, 2 times, it's like 2 times it's getting enlarged. Okay, so one is in the cervical part, one is in the lumbar part. Okay, in the lumbar it is L1 to S3. Okay, here is up to T2. So it's giving brachial plexus, and here it's the lumbar plexus, right? Yes. So this brachial plexus you will read in the upper limb, and this lumbar plexus you will read in the in some books it's given in the lower limb, okay, but in abdomen also, if in the osteology, okay, it's given, okay. So 2 times it's enlarged, one in the cervical part and one in the lumbar part, to give brachial plexus and the lumbar plexus. This is the very important. Vertebral level is the very important, you have to remember. One time Jipmer, they asked one question, okay, where in which is vertebral level this spinal cord enlarging maximum enlargement where occurs? Maximum enlargement at the level of C6. These things you have to remember, okay? At the level of C6, maximum enlargement, okay? So this is the normal things about this spinal cord. Now, one thing is that is called ligamentum denticulatum. Here, I want to write one thing, that is ligamentum denticulatum. What is that ligamentum denticulatum? Ligamentum denticulatum. Yeah, I want to rough this part. So, ligament denticulatum. What is this? Can you tell me? What is this ligamentum denticulatum? See, denticulatum, dental like structure. Okay, it is like tooth like projections. It is the tooth like projections. One first things, it is the tooth like projection. Tooth like projection. I will draw the diagram and I will tell you. So, let me draw one diagram so it will be easy to understand what is this ligamentum denticulatum. This ligamentum denticulatum is the modification of, modification of the pia mater, right? So, what happening if it is your spinal cord? Suppose this is your spinal cord, right? This part is your spinal cord. So, this is ligamentum denticulatum is something like it's like denticulatum like structures, right? So, it can be like this. From here it's very sharp, okay? So, it's like this. Tooth like projection, right? Yes, it's like this. Tooth like projections. So, this, okay? So, tooth like projection from spinal cord, okay? 2 in number. How many? 2 in number, but either side there is a 21 projection. 21 projection, right? And it's attached to the dura mater. So third point is the attached to dura mater. 2 in number, either side 21 and attached to the dura mater, right? And it is very important landmark in the neurosurgery, right? Neurosurgery means, in the neurosurgery, and if you want to do something in the spinal cord, okay, we have to do this, okay. So here is I am drawing one diagram. This is your, here is your spinal cord, right? Here is your spinal cord, and from here this is the things, okay. Here is the one thing is the ventral root, and second is the dorsal root, and here is the tooth-like projection, right? So here is the tooth-like projection. This is called what? This is the ligamentum denticulatum, right? Here is this part is the dorsal root, and here is the ventral root, right? So if we are, this is the anterior part, this is the posterior part. If we are front of if our knife during the surgery, if our knife is here in this portion anterior to the ligamentum denticulatum, what is meaning of this? Meaning is like we are anterior to the ligamentum denticulatum and near this vertebral roots, okay. So ligamentum denticulatum is nothing, it is the modification of the pyometer, and it is tooth-like projection, 2 in number, but in either side there is the 21 projections, right, and attached to the dura mater. And see, where is the dura mater? Tell me, where is the dura mater? See, whatever I have drawn, this is the pyometer only. Here will come arachnoids, and after that it will come the dura, okay. So it's attached to the dura mater, and very important landmark in the neurosurgery, okay. Okay, these things you have to remember, right? Now I want to tell you about white matter and the gray matter of the spinal cord. So let me draw one diagram. There is nucleus, okay. So they will ask in the exam, okay, nucleus of the gray matter. It's very easy. There is a number of nucleus, but it's very easy, okay. So let me draw one diagram. This is your spinal cord diagram. Here, this is your spinal cord diagram, okay. So here, this is one thing. This is the things, right? Now, in this this is the diagram, right? So you tell me, where is the white matter and where is the gray matter? In the central nervous system, what we have seen? We have seen this, like, this is what? Gray matter, and this is the white matter. I draw there one diagram like this. Okay, from here, this is your cortex part, and from here its bundles coming. So gray matter and the white matter. But what happening here? It's just opposite. Here is what? Here is the white matter. This is the white matter. This is the white matter, and this is the gray matter. This is the gray matter, okay? Yes. Now, there is some nucleus, okay, which we have to understand. We have to know the nucleus. So, it's very easy. It's very easy. Here is the 3 nucleus. 1, 2, 3. Here are the 3 nucleus. What is the name of this? Name of this nucleus? See, this is very simple. This is the I want to rough this part. Here, this is the white matter, okay? Suppose here this is the white matter, right? So this is the lateral. So this is the lateral nucleus. This is the lateral. Here is the this is the middle. So this is the medial. Here is the lateral and this is the intermediate. So there is 3 nucleus. One thing I want to tell you before discussing anything, that this is the posterior horn. Posterior horn, and this is the anterior horn. Anterior horn. These things you have to remember. Okay, this is the anterior. See, this is the anterior side. This is the posterior side. Right? Here is the anterior horn. Here is the posterior horn. So in the anterior horn, there is 3 type of nucleus. See here, lateral nucleus, intermediate nucleus, and the medial nucleus. Now, for which muscles? Okay, and one thing, this posterior horn is for the sensory or the motor. This is for sensory. This thing is the basics. This is sensory, and anterior horn for motor. Right? So 3 nucleus. Lateral side, so that is lateral nucleus, medial side, middle nucleus, and in between, intermediate nucleus, right? So, this is for what? Which muscles? Now, tell me. Lateral. See, this is the lateral. Okay, in our body, what is the lateral? This is the lateral. Can I tell? Limbs. Right? Limbs are the lateral. This is lateral. This limb is also lateral. So, limbs are lateral. So, lateral. For this lateral, it's innervate the limb muscles. Limb muscles. Okay, L to L, limb muscles. Now tell me intermediate. Intermediate here is somewhat, intermediate our body, intermediate here. So diaphragm. So phrenic nerve, right? Phrenic nerve. And in intermediate, diaphragm. Diaphragm, right? So which nerve? Phrenic nerve. Phrenic nerve, right? Root value of phrenic nerve? Tell me. Okay, and this is the medial part. So, if this is the lateral, this is the intermediate, what is the medial? This part is the only medial, no? So, muscles of the thorax regions, okay. So, thorax region muscles are innervated in these things. So, here is 3 nucleus only, lateral, so lateral nucleus, medial and intermediate, okay. So, next thing, here is the 2 nucleus. Here is 2 nucleus present here. So what is this nucleus? Only 2 nucleus. So one is the medial. Can I write here? Medial nucleus, and this is for lateral nucleus. So can you tell me medial nucleus and the lateral nucleus what it will do? Yes. So come here. It's very simple. It's very simple. Medial. This is the medial and here is the lateral, right? So medial for the parasympathetic, for parasympathetic innervations, and the lateral for the sympathetic. Sympathetics, right? How you have to remember? MP. See here, MP. Here is the MP and LS, Lok Sabha. MP, you know, MP, MLA. So MP, where is MP? Where it's? These are in the Lok Sabha. So M is medial nucleus for the parasympathetic, lateral for the sympathetic, right? So over. So up to this intermediate, up to this anterior, medial horn and the intermediate horn, this over. Now here is the 4th nucleus. 1, 2, 3, 4. Can you tell me the name? One is the substantia gelatinosa. One for the VA. Afferent, okay. Visceral afferent. One for the visceral afferent. One for the substantia gelatinosa. Right? So there is one thing which is called 4 nucleus. This is 4 nucleus which present into the anterior, sorry, in the posterior horn. I am going to write here, okay. So this thing you should remember, MP and the Lok Sabha, okay. So I am writing here. So one thing is the substantia gelatinosa. Substantia gelatinosa, right? So this is for what? This is for spinothalamic tract. As substantia gelatinosa for the spinothalamic tract. Can you tell me spinothalamic tract what it does? Oh, it's for temperatures, for pain, for crude sensation or touch, right? For this, spinothalamic tract is responsible for that, pressures, okay, from the whole over the body except face. Can you tell me from face, temperature or pain, pressures, which now is carrying? What is the principle now for the head and neck? That is the trigeminal now, yes sir. So, this from whole body, okay, from face and head and neck regions, from the which now? That is the trigeminal now. Okay, so first nucleus is the substantia gelinosa. So here is the SG, right? Or S means spinothalamic tract. Okay. Second things. Second is the nucleus proprius. Nucleus proprius. Okay. This nucleus proprius, you remember from P. P means posterior tract. So this is for posterior tract. Posterior tract, right? So in the posterior tract, and this third nucleus. This is for VA, visceral afferent, right? VA. And can you tell me the fourth nucleus? That is fourth one is the nucleus dorsalis. Nucleus dorsalis. Okay. So this nucleus dorsalis is for what? This is for spinothalamic tract, and this is for spinocerebellar tract. Spinocerebellar tract. Okay. So what you have to remember, see. First of all, what we have to see the extension and everything. So, okay, that is very, very simple. Right, that is very, very simple. After that, what we have seen, that is one structures, okay, and you know DAP, diameter, right, not diameter over. After this, okay, see it. I don't think in the anterior horn there is problem. No. Lateral, intermediate, and mediate over. Here is the lateral and mediate over. Here is the fourth. Substantia gelinosa. One thing is this. Second thing is the nucleus proprius, and the fourth thing is the nucleus dorsalis. Okay, so this is over. These things you have to. Up to this you have to remember. Okay, so this what we have discussed this. This is the whatever we have discussed this. No, we are discussing gray matter. Okay, so remember this is the gray matter. Gray matter. Okay, so whatever we have discussed so far, that is for the gray matter. Can you tell me something for white matter? White matter. What is the white matter? This is nothing. Axons only. Okay, aggregation of the axons. And here in the spinal cord, you know, see. If you touching me here, okay, I am touching here, some sensory fibers will go, I am touching here, abdomen, okay, thorax, whatever. So what will happen? From here, sensory pathway, it will go, and from central nervous system, what it will do? It will compare that informations, right? And after that, central nervous system will generate some new informations, okay, and that will come. So there is some ascending track and the descending track, okay. So in the white matter is nothing. What is the white matter? White matter is just axons only. Okay, so there is two type of track. One is the ascending track and second is the descending track. Okay, that all you know. Okay, that is the part of the physiology. I should not discuss that all things here, right? So, okay. After that, very, very important concept, that is the UML and the very important concept. You have to understand one thing, UML and the LMN. Remember one thing. Here is the UML. Okay, very basic concept. Remember, UML, upper motor neurons. Okay, one thing is there, LMN. Okay, so UML and LMN, and it will act on the target organ or cells, whatever. Right? Now what happened? What is this function of this UML? It is overacting. It doing overacting. So overacting or overaction. We can tell overaction, right? And here, this is the director. Director, okay. In Hindi film, who is doing very overacting? That is like Alia Bhatt, okay. Alia and if you are from South India, okay. So, Bal Krishnan is there, okay. So, they are doing overacting, okay. So, what this upper motor neuron is doing, it's just controlling these things, okay. So, lower motor neuron should not overact, okay. It should not overact. So, this is only controlling these things. Now, you tell me, if there is upper motor neuron, if there is upper motor, this is neuron, right? So, if there is upper motor neuron lesions, what will happen? If there is upper motor neuron, what will happen? You tell me. Can I write here? Yes. If there is upper motor neuron lesion, so this will overact. If there is overact, it means what will happen? Can I tell? Spastic paralysis. Spastic paralysis, one thing. Second thing, it will overact. Overact, it means tone will increase, right? Third, reflex. Tell me, what about reflex? It will also increase. And fourth is what? Babinski sign, it will be positive. What is the Babinski sign? That is plantar arch, that is reflections, right? So, you know about that, okay? So, Babinski sign will be positive. Because, see, upper motor neuron has gone. Okay, so now everything in the lower motor neuron hand, okay? And there is no controller. So, it's doing overacting. So, upper motor neuron palsy, UMN palsy. Okay, what can be the symptoms? This all are, right? And what happens if there is lower motor neuron palsy? See, if there is lower motor neuron palsy and upper motor neuron is the okay, it's well. But here is problem. Okay, palsy happen in this. So what will happen? It will not act, right? So what will happen? Paralysis is there, but which type of? Flaccid paralysis. Okay, so see here, flaccid paralysis. Flaccid paralysis. Second thing, tell me there is a tone, increase or decrease? So tone, it will decrease. Tell me reflex, it will increase or decrease. And tell me the Babinski sign. Babinski sign, it will be negative, right? So many exams they have asked like which one of the following is feature symptoms of the human palsy and LMN palsy. Okay, you just remember upper motor neuron is the controller, is the director, and this is the lower motor neuron is doing overacting. So it's just control these things. Okay, so this is the things. Okay, I hope you got it right. Now we are going to see this upper motor neuron and lower motor neuron palsy in the facial nerve. Okay, remember, concentrate very well so you can understand the thing. See here, here is your beautiful face. Here is your beautiful face, right here. So here is the eye, here is your nose, here is your mouth, right? So I am dividing it in the 4 quadrant. See here, this. Okay, yes, this is the right side. Okay, so here is nucleus. This nucleus. This is the superior nucleus, this is the inferior nucleus. Am I right? This is the nucleus of facial nerve. Nucleus of the facial nerve. Right? Here is also 2 nucleus. This is the superior, this is the inferior nucleus, right? Now one thing you should remember, this nucleus of the facial nerve is controlled by cortex. So I have to draw here cortex. Here the cortex, here right side, and here is the cortex of the left side. What I said, nucleus of the facial nerve is controlled by cortex, not same side cortex, opposite side cortex. So here, this is the right side. So control of this nucleus is done by this cortex, right? So what will happen? Sensation from, see, this is nucleus, this is also nucleus, right? This is the upper motor nucleus. This is what? UMN, upper motor nucleus, and this is the lower motor nucleus. Right? So opposite side it will control. If new fibers from coming from here, sensation will come from here. So what it does, this things, superior it will supply here, inferior it will supply here. Up to this okay? Are you with me? Yes. Now what will happen? Facial nerve gives few fibers only superior nucleus, not inferior nucleus, from same side. So I am showing you black. From cortex, from same side cortex, facial nerve gives some fibers to the superior nucleus and it will supply to this part. This part only. Okay. Are you with me? Yes. Now you tell me what will happen in the, here I am writing, okay. What will happen in the left upper motor neuron palsy? Now remember, concentrate here very well. Left, so this is left, upper motor neuron. So here is neuron, right? So if any palsy is here, this is not working. Okay, this is not working. So sensation from here to here, it will not come. Right? Sensation from here, it will not reach to this part because this center is not working. So sensation is not coming. If sensation is not coming, then what? Sensation will not go to this region. Am I right? Yes. So according to you guys, ipsilateral paralysis will be there. Ipsilateral means full half portions, half part of the face. Okay, right side. This is the right side and this is the left side. So right side fully is not like there is paralysis from your point of view, but it's not like that. See, fibers is not coming, sensation is not coming from here. Okay, not going here. Okay, both will affect, but sensation from same side, from cortex, few fibers. Facial nerve gives only to the superior nucleus. See here, this fibers is coming. So from here some sensation will come and that superior part will supply this portion, upper 1/4, this portion, okay, it will supply here. So here will be sensation. Okay, which part will affect? Only this part will be affected. Okay, so in the case of left UMN palsy, it's not supplying fully half portion, but upper half is supplied by also this part. So there will be sensation. So there will not be paralysis here, but only here paralysis. So that condition is called what? Right side only contralateral. See, right side paralysis will be there, and that is the contralateral paralysis. Right? Only lower part, it will get paralysis. Okay, I hope you understood. Now, second thing. This is one second thing. Now what we are going to see, right side lower motor neuron palsy. Right side. So this is the right side. Lower motor neuron. So this is, see, these are the lower motor neuron. Right. So right side, this neuron has gone. This neuron has gone. Now nucleus has gone. Now tell me, fibers is coming from here. Okay. Okay. But this is not functional in this nucleus. So fibers, so sensation will not transfer to this part. Right. Right. So this structure again will go. Okay. Now see, since this full superior and inferior nucleus, which are called lower motor nucleon, is damaged totally. So some fibers which coming from here, it's coming to the superior nucleus, but this nucleus is not functional. Palsy happened. So what will happen? These fibers, this sensation through these fibers will also be affected. Yes, it means now in this region, in this region, there is no sensation. It means paralysis happened. So in the right LN, you can see what will happen. Ipsilateral, right side, but ipsilateral entire half of the face. Okay, I hope it's visible. Okay, so in the right lower motor neuron palsy. Okay, so this is full gone. If it is gone, so this fiber will go, this will go. Okay. So sensation from this part is affected. This is called lower motor neuron palsy, and entire half face is affected, one side face, and that is called what? Bell's palsy. So in the Bell's palsy, whenever examiner asking what is the Bell's palsy, if you are telling okay, paralysis of the facial nerve, if you are telling paralysis of the facial nerve, okay, examiner will tell you, stop, tell me whether it is upper motor neuron palsy or the lower motor palsy. After that you will think and you will ratify. Okay, if you are a ratifying, you can't give correct answer. See here, lower motor neuron palsy. Okay, and that is why this entire half. So what is the symptom of the Bell's palsy? Tell me. Drooping of the eyelids, right? Wrinkles here, wrinkles will be disappear, right? Nasal will fall, it will also disappear. Okay, drooping of the eyelids. What will happen? Saliva will be okay. So that all are the features. Okay, so that is the Bell's palsy. Okay, yes. So everything we have covered, and now only one thing that I want to tell you. That is the blood supply of the spinal cord, right? So this thing is the very, very important and very, very interesting things. Okay, so now blood supply of spinal cord. Okay, spinal cord, right? So it's supplied by mainly two arteries, that is called anterior spinal artery and posterior spinal artery. So this anterior spinal artery, this is 1 in number, but this is the 2 in number. Okay, so what happened if I draw one diagram, like no need for drawing diagram, but still see, this is, here is the anterior spinal artery and here is the posterior spinal artery, right? Yes. And one more important thing, anterior spinal artery is supplying anterior 2/3 of spinal cord, and here is the posterior 1/3 is supplied by this posterior spinal artery. And anterior spinal artery, you know, it is a branch of what? That first, it is branch of VA, vertebral artery. Can you tell me the posterior spinal artery is the branch of? It can be branch from vertebral artery and pica. Sometimes it's branch from pica, some from vertebral artery. What is the pica? Posterior inferior cerebellar artery, right? So this is the blood supply of the spinal cord. Okay. One more thing, there is the one more artery that is called segmental arteries. Okay. So there will be anastomosis. See. Here is one plexus that is called this is plexus. Okay, so what will happen in this condition? See, segmental artery is there. So segmental artery, right? It is of two types. Segmental artery. So there is the anterior radicular artery. Radicular artery, and here is the posterior radicular artery, right? So this anterior radicular artery is further of two types. One is the ascending branch. I hope it's visible. Ascending, and second is the descending branch, right? Descending branch. Okay, this both will anastomosis with the long arteries, and that is what? Anastomosis with anterior spinal artery. Okay, and it all will form one plexus that is called this plexus, right? So this is the artery supply of the spinal cord, right? So this is the artery supply and everything. White matter, already I told you the white matter is the tracks, nothing else. See, here is the white matter. Okay, so remember one thing, this is the anterior. So anterior part, this is the posterior white column, anterior white column, and this is the intermediate white column. Okay, so these things you have to remember. Okay? So extension, layers. After that, the nucleus, very important, Lok Sabha, MP, Lok Sabha, right? Lateral, median, intermediate, everything okay. After that, UML and the upper motor neural palsy and the lower motor neural palsy, and after that blood supply. Okay, so I hope you got the spinal cord. Okay, any questions now you can do it. Okay, so what is the modification of the parameter? That is the final terminalis and the denticulate process. Okay, so if you want to draw spinal cord in this diagram, okay, meninges layer, how you will draw? So see. Here one things, here will be your arachnoid membrane, right? And here will be your duramen. Okay, this is how you have to draw. From here it will cut and it will go like this. From here it will go like this, and after that there is the dorsal and this is the ventral spinal column. Okay, so I hope you got it. Okay, so thank you very much.